Good morning, friends, colleagues, collaborators. It's a real pleasure to be here with you today. We started this global adolescent health conference with powerful and inspiring statements from world leaders. We are now going to listen to the voices of young people. 4 young people: Gogon Tlejang Paladi from Botswana, Raina Foster from Canada, Anthony Lopez from the Philippines, and Irem Tuma from Turkey. These 4 young people, these 4 young leaders are going to speak to 3 things. 1, what does the theme of the conference mean to them? 2, what is their reading of where the 4 pillars of the conference are today and where they need to be in, say, 5 years? And 3, what do health, development, and humanitarian agencies need to do differently so that, like Amina Mohammed said, they take the voices of adolescents and they act on them, so that adolescents are not left on the sidelines as they were during the Millennium Development Goals. So we're going to have the voices of these 4 young people, and after we've heard from them, we'll expand the circle to hear from you. It's my privilege to have this conversation with them and with you. My name is Chandramouli. My transition from adolescence to adulthood took place 40 years ago. So single-handedly, I destroy the average age on this panel. But my work with and for adolescents with the Young Men's Christian Association in Zambia, in India, with non-government organizations working to prevent HIV in northern Zambia, and with WHO, the World Health Organization, for the last 20 years, has kept some of that adolescent in me alive. So let's get going. To start with Anthony. Who are you? And what is the theme of the conference? Unleashing the Power of a Generation mean to you? You have 2 minutes starting now.
All right. Is my mic on?
Your mic is on, I believe. Go ahead.
All right. So my name is Anthony Lopez, and I'm a Women Deliver young leader from the Philippines, and I'm also a peer educator with Y Peer Pilipinas, and I'm the project manager and founder of CAPI's Youth for Sexual and Reproductive Health and Rights. So I grew up watching Power Rangers, and who doesn't know the show? It's about 5 teenagers who were asked to save the world, right? And one of the things that I learned watching the show was that when young people, specifically teenagers, get together to reach a goal, they can and will destroy everything and anyone who stands on their way, right? So when we speak about unleashing the power of this generation, we talk about a power that is already there, existing within each and every child and young people in the world, trapped in a cage that society has created for them to stop them from reaching their full potential and from influencing how the world is presently ran. So today's generation of young people is the largest the world has ever seen. So make everything right for this generation. You're not only making yourself a favor, but you're also making a big step towards making the future better for your posterity. This means that the youth, the young people who have waited for so long to showcase their capabilities, strengths, intelligences, innovative ideas should and must be given a space for them to fulfill all their dreams and aspirations, thus unleashing the power. This is what this conference is about, the power that is young people. And I say, just give children, adolescents, and young people the right environment and conditions, we will not only be a formidable power, we will be unstoppable. So what does this mean to me? It basically tells me that this generation is formidable, unstoppable, and powerful. Thank you.
Formidable, unstoppable. Over to you, Raina.
Okay. Well, my My English name is Raina Foster. My given traditional name is Debagogijaguk. I am from the Ojibwe territory of Treaty 3. I am the former Laxal Youth Chief in my First Nation. And, well, to start off with the theme of the conference, there's this Ojibwe teaching and this Ojibwe prophecy about the 7th generation. And to recap on that, each set of generation of youth is 20 years. And since Canada is celebrating its 150 years anniversary, that means that we have been here for 7 generations and in a total of 140 years. And in 10 years, we will have and we will reach the 8th fire, or the 8th generation. And unleashing the power of this 7th generation, it is setting the path for the 8th generation. And youth of today have so much potential and power and so much resiliency, and it's important for them to realize that. And so unleashing the power of the 7th generation, that is really vital and formidable and unstoppable.
Thank you very much. So we've heard unstoppable twice. Irem, over to you now, please.
Thank you, Chandra. Hi, everyone. I'm Irem. I'm a 25-year-old Turkish woman. And above all, I think I'm very lucky. I'm very lucky because my parents prioritized my education over anything else, which led me to get a law degree. I'm very lucky because I grew up with an inspiring mother who worked on HIV/AIDS, which triggered my interest in social change. I'm very lucky because I got in touch with the European Youth Parliament, or Women Deliver, and found spaces where I could find other like-minded people and work for social change. And I'm even more lucky to be addressing you today as a UNFPA fellow. And I'm very, very lucky because here, being young and female is not a ground for exclusion, but something to be celebrated. And that is something that is actually very rare in many other parts of the world. Which brings me to what the theme means for me. So in all honesty, for the last week, I've been trying to come up with the perfect fact or the statistic to tell you about the potential that we have. And on one hand, I want to tell you the positives. I want to tell you about, the under 30 CEOs who are revolutionizing technology. I want to tell you how this generation is the most interconnected, most well-educated, and the healthiest of all. But at the same time, I also know that the same demographic, especially adolescent girls, are the most vulnerable. They are the unemployed ones, they are the employed ones that are working in precarious conditions, that are the ones that are victims of violence, especially sexual violence. So at the same time, the tale of this generation is about innovation, resilience, and potential, as much as it is about vulnerability, violence, discrimination. So talking about the theme, I go back to myself, and I think it shouldn't be about luck that I'm here with you today. I think we should be able to take it for granted that we can access young people, we can give them the spaces where they can actually make some change, and we can give them the support so that they can actually have a say on their future. And I think that unleashing the power of a generation shouldn't be such a grand idea, because this duality that we see is because of institutions and treatments that we inherited. So this is about restoring what should have been in the first place. And I think that's the direction we should be going for.
Thank you, Irem. Gogan Tlajang, the last word on this issue for you, please.
Yes, thank you very much. First of all, Chandra, I'm going to give you an A for pronouncing my name perfectly. Great. And then the adolescents in the room, viva young people, viva!
Viva!
Great, fantastic. My name is Gogan Tlajang Paladi. Quite a good number of people struggle with pronouncing my name, so they just call me Gigi. And I'm from Botswana, and I basically do what I do, which is, human rights advocacy, but also a lot of philanthropic work, humanitarian work, and civic education in my country, but also in the context of Africa. Mainly for two reasons. I got into this field because, number one, just over a decade ago, my country had the dubious distinction of having the highest HIV prevalence in the whole world. And this is a matter that even hit home because I also lost some close relatives to AIDS. And we're seeing a lot of orphans and vulnerable children. Our government was overwhelmed. And I just thought to myself, you know, in my little sphere of influence, or with the little that I have, even though I'm young, what can I do to help those who've been infected and affected by HIV, particularly orphans and vulnerable children? And then the second reason why I do what I do is because I would say I spent the first 14 years of my life wondering why God cursed me by being born as a girl child. Because everywhere I went, if I wasn't judged for being too young to achieve, too young to think a certain way or to have a certain view, it was always a challenge of my gender. So it's almost as though as a young person, you're double underprivileged or double challenged for being a girl child. And it's only when in my late adolescence that I decided, you know what, I'm going to embrace this. If at all the world is accustomed to young people and women not being capable, not being competent, and not being trendsetters, then maybe that's a challenge that I'd want to overcome and prove everybody wrong. And then what the theme means to me, I think just in two ways, unleashing the potential of young people. I think it just basically speaks to the need for us to see the value add in young people, the potential that young people have, and to tap on it and capitalize it. Stop seeing young people as a problem to be solved or as just mere beneficiaries or as threats, but rather as partners for development, and be able to harness that potential very well, so that we acknowledge their contribution to driving the sustainable development agenda. And then the last thing, I see it on the other side also as a challenge to us as young people. What are we doing to ensure that we work with whatever we have, we use our demographic weight, our young energy, youthful energy, and our literacy with technology to be able to inspire the change we want to see? And so I always tell the young people that I mentor, mostly are ladies that I work with, and I tell them that whenever you don't have a seat at the table, dress comfortably to be able to sit on the floor, because you need to be part of that conversation either way. Yeah.
Thank you for a wonderful set of comments. Two themes emerge. You know, there are powerless young people, but there are young people who have shown power, who have shown potential, who have achieved results. So the message we hear is young people need support. We need to build their capabilities, and then we need to give them the space and support to use these capabilities to bring about the tremendous change that they could. So what does the theme mean to me? After this terrible rape and killing in Delhi some years ago, I asked my sister, who's 6 years younger than me, what was it like for you growing up in India? We grew up in Secunderabad. In central India, central South India, middle-class neighborhood, leafy streets. Walking to go to the school, my sister told me that she was flashed at 40 times, to the point that it became a fear for her to walk to school. She never told my parents. She never told us 3 elder brothers. We need to give young people the potential to grow, but we need to protect them so that they can grow and develop. We can't just send them to work and send them off to school and let them take care of themselves. They are children growing up in an adult world, and we need to protect them just alongside building their capabilities. So that's my reading of the theme. The second issue that we want to go into is the 4 pillars of the conference are sexual and reproductive health and rights in adolescence, mental health in adolescence, nutrition in adolescence, and data on the health, well-being, and development of adolescents. So what do these themes mean to you? And where are we in your reading with these themes today? Where do we need to be in 5 years? 1 point. You have 1 point. A couple of minutes each. Who wants to go first?
Should I?
Don't all jump.
Okay, I can jump.
Iram,
Okay.
please.
So since I need to narrow it down to 1, I think I'll go for the SRHR point that I wanted to make. I think it's very important that we see the interlinkages between all the pillars, but also in SRHR, and also take a holistic view. And when I look at where we are now, I think that with the increasingly conservative environment we seem to be in, it is a reminder that things that we took for granted, like gender equality, like freedom, like non-discrimination, can be challenged at levels that we thought were not imaginable. And at such times, I think it's more important to be guided by principles and values and not just go for what is funded or what flies, but to actually stand up for what should be. And we cannot just take a look at adolescents and see them as mothers or future mothers or wives and not talk about LGBTI, not talk about unsafe abortions, not talk about gender-based violence. So 5 years from now, I hope that it won't be a question mark, that everything related to adolescents and everything around sexual and reproductive health and rights are interdependent and fundamental. And I hope that we'll be able to stand up for these without hesitating in this environment that we're in.
So we see a world where these things will be legitimate issues that we can work on.
Exactly.
Who's going next?
Sure, I can go next. I just wanted to say maybe about 3 things. I think these are all very broad, and these are also very big challenges, well, particularly in the context of Africa. And like she has said, they're also interdependent, they're also intertwined. So it will be very difficult to just speak on one of them because somehow it contributes to the deficits in the other area. But maybe just to mention 3 things that maybe even also the opening speakers talked about. I think one of the first challenges that we face in Africa, I tend to feel that there is, sometimes when we talk about human rights, particularly sexual reproductive health and rights in the context of Africa, there's an assumption that African countries, or as Africans, we inherently appreciate human rights. But you can attend so many meetings on human rights in Africa, and almost all of the meetings will not mention sexual reproductive health and rights because many of those are taboo issues. I mean, right now you find that in sub-Saharan Africa, among the leading causes of death among young women is unsafe abortions. But we're not willing to have that conversation around abortions, around LGBTI communities. So I think it's important that we have that dialogue at the highest level on those uncomfortable issues. Another thing that I also thought we should say, we have seen progress in the fact that, for example, the AU declared last year the focus on women, and this year the focus on harnessing the demographic dividend, which is very good for motivating political will and commitment at the highest level. But one of the problems we have is that our leaders don't have a problem with signing human rights treaties. The problem comes in implementation. And this is where we need to build up the capacity of young people, of youth-led organizations to be able to lead in that citizen-led accountability for all these instruments, all its mechanisms, but also for general delivery on human rights for especially adolescents and young women. And then the last thing that I wanted to talk about is also the governance issue. I think it's very important to realize that, I mean, just as the global strategy outlined, investment in young people is not enough if it's just in the health and not other aspects. So governance is very important because it's a huge enabler for progress and development, but if not addressed, is a huge impediment for that. So we need to also have a conversation around the governance deficits that exist in these countries. So yeah, I'll stop there for now.
Thank you. You've really gone on into the third issue, which is about what do agencies need to do. But that's very good. Please, Anthony, Reina, anything to add to this? Build on this? Okay. Disagree?
So I will be addressing the pillar of mental health and more specifically the ongoing rates of First Nations youth suicides in care and in First Nations communities. There is a significant health disparities between non-Indigenous and Indigenous Canadians. Since October 2016, there has been youth suicides in childcare, and one of them being a government agency. And there has been also suicides in First Nations communities, and that is still ongoing. First Nations youth are 5 to 7 times more likely to die by suicide than any other non-Indigenous youth. How can we unleash the power of the 7th generation if youth who have potential are dying in the hands and in the care of government? And for today, with the slow processes, we are far away from fully addressing what is going on. We are far away from full and genuine action from the government. And we are dealing with a health gap that is taken and filling the lives of First Nations youth. 5 years from now, we should not have to continue having the same conversation that has been going on for 20 years, give or take. In 5 years, we should have quick action, lots of implementation, and most of all, we should not have a government that has failed First Nations youth and First Nations people for 150 years. And this is why I am addressing mental health, and this is why I am advocating for First Nations youth.
Thank you, Lena.
I was originally planning
Quick comment, Anthony.
Yeah, I was originally planning to talk about HIV and teen pregnancy and LGBT rights. So I'm going to stick with LGBT rights because Iram and Gigi already talked about SRHR. So all over the world, we see countries like Canada who's very accepting, loving of LGBT communities. There are also countries like the Philippines who is very tolerant but not really accepting. But there are also countries that do not, recognize LGBT communities and outlaw homosexuality. And we see that right now. There's an ongoing struggle in parts of Russia, I believe, yeah. And it really affects young people. It affects adolescents as it forces them to go in hiding. It forces them to not access services, especially for young men who also have sex with males. It forces them not to access HIV-related services because they're afraid to be discriminated. They're afraid to disclose their sexuality or their behaviors because they're afraid of being reprimanded or being stigmatized. And this also affects how we collect data on the behaviors of LGBT people, even young people. I say this because if young people are not open in talking about their sexuality, we won't be able to get correct and comprehensive data to back up services that we want to implement for these adolescents. And unless we provide them with an environment that is nurturing, supporting, and loving. Again, I stress love when we talk about LGBT because that's the only way I see that we could penetrate the community and these young people. And although there are really steep barriers to overcome, I'm really optimistic that in 5 years, there will be significant advances in terms of the rights of LGBT youth, and countries, especially developing countries like my own country, would pass comprehensive laws supporting LGBT and non-discrimination.
Thank you. So clearly this House strongly believes that in 5 years, the world community, global leaders, national leaders, local leaders will acknowledge difficult issues, put these issues on the agenda, support the gathering of data on them, and act on them. And that's our challenge. So if that's the world we want to be in 5 years' time, the third question is, what do health, development, humanitarian agencies need to do differently? One thing that you believe they need to do differently. Iram.
Okay, me again. Hi everyone. So I guess I've been in this community in different capacities for the last 9-10 years. I was a local volunteer, I was a,
One
activist.
thing they need to do differently.
Okay, I'll get to that. And Chandra, very discreet. So basically what remains with me through all this enrollment is the human aspect of it all. And I think that it is really about putting people and their needs in the center and actually addressing them. And I know that for the next 2 days, you'll be talking about frameworks, pillars, targets, key populations, and all this. But just remember that we're talking about human beings. We're talking about human beings that are at the most critical stage of their lives. And what we talk about in pillars actually coexist in each one of them. So how can you just separate your hunger from your isolation or your health problems from your sexuality? They all coexist. And in dealing with chaos, I think we should go back to what we are here to uphold. And for me, that is freedom, that is human rights, that's human dignity, and that's equality. So unless all of our actions are guided by this, I don't think we can achieve what we want to achieve. But if we make sure that every step reflects these, then we can achieve anything, including the SDGs.
Thank you, Irem. So let's have one more comment and then open the floor.
Yeah.
Who wants to go? Please.
Sure.
Just one comment. I know, Gogon, you have a list of 5 with one issue.
Yes, I was going to say that there's an African proverb that says that you cannot shave somebody's head in their absence. So I think it's very important that all development practitioners meaningfully engage young people. But I was going to give an example of the PMNCA's Adolescent and Youth Constituency. One of the things that we're developing at the moment is having leadership and capacity building grants, because we were saying that a lot of development partners do capacity building for young people and youth-led organizations, which is great, but sometimes they're not given capacity to go and implement on the ground. So I think it's important that capacity building should match opportunity so that whatever happens at the global level, young people are able to replicate in their countries. Yeah.
Thank you. And that's something the adult leaders spoke about, you know, when we reviewed experiences 20 years since the International Conference on Population and Development. What we saw is that youth participation is nominal in many places. And we really need to move from that into meaningful participation. Say that, do it, and measure that. Anthony.
Okay. So, for one, we have to realize that adolescent health issues exist. So they're not children, just children, and they're not adults yet. They're adolescents. They have a whole spectrum of needs that need to be addressed, specifically during emergency situations. I'm going to focus on the humanitarian response in emergency situations. Now, even without emergencies, adolescents are a vulnerable population. Now let's think about what happens in an emergency situation. Most of the time, they assume the adult role. Now there's a variety of reasons why this happens, but most of the time, it's because they lose their parents or guardians in times of emergencies. Now my country has experienced multiple calamities in the past years. We have Haiyan, we have internal armed conflict, and most of young people and adolescents get displaced. So it affects how they get services, including food, nutrition. A lot of these children, young people, go without food in a day. That causes them to be more vulnerable to exploitation. And there's this case that we have in the Philippines before. It's called tira 20. Tira 20 is a slang term that we use for adolescent prostitution in exchange for 20 pesos, or roughly 30 cents US dollar, just to get something to eat. So that's how dire the situation is in times of emergency. So we have to look at adolescents not as a sector or a separate group, but as a part of a larger population with unique needs that need to be met. So we have to also focus on adolescent sexual and reproductive health and rights in emergencies, because it can save lives.
Thank you, Anthony. A quick comment from you, Reina, and then I'd like to open the floor to the participants for the next 10 minutes.
On a national and international note, it needs to be understood that there are resources, or mental health resources are very limited to First Nations youth. And what needs to change, there is a huge knowledge gap, and there are humongous barriers for First Nations youth. And what needs to change is that there needs to be no more talk. There needs to be more action. And with how scarce and limited our resources are, there needs to be funding. And there needs to be no more holds on our funding. And the government has had funding on hold for a long time. And that needs to change. That needs to stop.
Thank you very much. I think, in the context of the Millennium Development Goals, tremendous progress was achieved on many fronts. On childhood mortality, maternal mortality, HIV mortality in adults, malaria mortality. Adolescents were not addressed. We hope very much that in the context of the SDGs, this doesn't happen. And if suggestions from the youth panel are taken on board, there will be action on the ground translating into tangible results that we can celebrate in a couple of years. I want you to join me in giving the panel a big hand. They've kept to time and they've kept to plan. And so what we have is about 15 minutes for discussion. We want to take the last 2 minutes to come back to them for their voices. So the floor is open for adults and all the adults who support adolescents and the adults who support adolescents. So please, Katie, a mic, where would people speak? There are 2 mics there, anyone? Please. Please introduce yourself and make a quick comment or question.
Good morning. My name is Tamara Window-Melmer. I work with Women Deliver, and I want to thank all of you for that amazing panel. That was really insightful and really helpful to all of us in the room. My question is, in moving forward together, what is it that you feel as a young person you need most from your adult allies here in the room and those that are not here in the room? Thank you.
Thank you, Tamara. With your permission, we'll take a couple of questions, comments, and then one or more of you could respond. Any other volunteers? Otherwise, I'm going to point you to volunteer you. Please.
Hi. Oh, sorry. I think this is on. Okay. Hi, my name is Kiran Patel. I'm with the American Academy of Pediatrics and NCD Child. Thank you so much for sharing all of your thoughts today. This kind of tails on to Tamara's comment about how can we help young people develop their message? So there were a lot of thoughts and really interesting ideas and things we need to work on. So how do we help young people and adolescents develop that elevator speech so when they are giving these pleas and calls for advocacy, they're able to say it in a succinct way while still being able to get across their message?
Thank you. So that builds on the previous comment. What do you all need? How can we support you to communicate even better than you've done?
Hi, thank you for the excellent panel. My name is Mtisunge Kachengwe from the YWCA of Malawi. My question is going to focus on data. In terms of moving forward to the SDGs and as youth-led organizations, as youth, we're saying we want to be in platforms with policymakers. But I feel as though as youth and even as we're doing our activities, how do we get that data and how do we collect that data? I've always been told what doesn't get counted really doesn't matter. And we need to reach at that platform as youth data, how are we collecting the data and how do we access the data to be able to push our agenda ahead?
Thank you very much. We'll take this last question and comment, but I just want to stress that these questions and comments are really ones that should go through the entire 2 days. What we have done, what they've done beautifully for us is frame some issues and put some issues on the table. What we really need to do is try to answer them now, but come back to George Patton, to Ian Askew, to Gwen Hainsworth, and push them and challenge them to answer these questions too. Please. Over to you. Any one of you want to answer? To respond to this? Okay, sorry.
Sorry, I just have a last comment. It especially resonated with me what Gogon Lejang said about her comment about being born a girl and it was a double curse. And I think that is something that, we really, I hope this group in the next 2 days, we can help to remove that double curse from all the girls. And I'm Tista Soman from Grand Challenges, Canada. Thank you.
Thank you. Okay. Thank you for your questions, comments, and please keep them coming. Please hold them. Let's get some quick reactions from here. Please, anyone.
Go ahead. Okay. All right, so
Please keep it short so that we can get more.
yeah, honestly, if you ask me what our adult partners could do to help us, young people, investments. Lots and lots of investments. And because whether we like it or not, whether admit it or not, we can't move without money, right?
Thank you. Money and lots of it. Hiran.
Actually, money and lots of it, but used in a smart way, strategically, is how I would expand it. I think that very concretely, we need networks or organizations that are actually youth-led in the way they're structured, with just a support mechanism from, let's say, the older generation to support them. And I think, for example, YPR, European Youth Parliament, Women Deliver Fellowship Program, we have concrete examples, so let's just make use of them.
Please.
Okay,
Great.
and to add on to Anthony and Iram's comments, financial assistance is key, yes. However, it's important to delegate for the youth, and it's important to not steer their conversation away from them. And in most cases, and first-handedly, I had witnessed some adults steer that conversation away from us. And I did not stand by that. And there's this quote that resonates within me. And it goes, "Those who criticize our generation forget who raised it." And that's why it's important for youth and adult partners to delegate.
Thank you very much. So we talked about this curse of being a girl. Just want to put one issue on the table. We're going to talk about it later on. Most girls in the world learn about their periods on the day their periods start. They start bleeding in school and think that they're dying because something is rotting inside and is coming out. They don't get the information they need from their mothers, their sisters, or in school. They're often not able to go to school because there's no toilets there. And they don't have panties, leave alone sanitary pads to place in panties. So if we're talking about unleashing the power of a generation, we have to start with some very, very, very low baselines in many places. Okay, Katie is giving me a smile, so that means we have 10 minutes more. Any comments, any questions, any takers?
Chandra? I just wanted to add.
Please, go ahead. Quickly.
I just wanted to add to the comment about data earlier. And I also feel that a lot of areas, even though there are overwhelming amount of data in other parts of the world, there are still other areas in other parts of the globe that really need assistance in getting data so that services and programs could be put in place. Just like in my community, my own community, there is zero, not really zero, but if you think about it, there's really minimal research on sexual and reproductive health and rights or LGBT rights in our area. So that's why our own politicians do not support any or support only a few kinds of services related to teenage pregnancy and HIV/AIDS, because there are no evidences to back it up.
We need data.
We need data.
Okay, we have 4 people waiting there. We'll take their comments and then we'll wrap up this session so that we can go into the next one in good time. Please.
Okay.
Quick comments, please.
Yes. Good morning. My name is Takale Tai from Malawi, representing the PMNCH Adolescent Youth Constituency, as well as the African Youth and Adolescent Network, AFRIAN. So quick comment. As young people and youth leaders from all over the world, one thing that has always been a challenge, and I think it needs to come out, is that a lot of young people are volunteers. And they work so hard and they do incredible work, but most of it is not professionalized. And I feel like that's been a big challenge to advance this agenda. And I think it would be incredible for you guys to just briefly share, and I know most of you, they're probably volunteers doing all this work, but a lot of them don't understand the challenges you face to go to that meeting, to advocate for those issues, to get the little resources to help those young people in the community. And I feel like maybe you can share your advice going forward to advance and change this and professionalize it. Thank you.
Please.
Hi, my name is Alison Riddle. I'm a researcher with the University of Ottawa. I wanted to get your perspective on something I recently experienced. I was doing a gender analysis in an East African country, looking at the ways that men and women, as well as adolescent boys and girls, are vulnerable to malaria and how they respond to malaria. And what kept coming up, we interviewed adolescents, but we also interviewed health authorities, health workers, local leaders. When I asked adults, basically, why are children vulnerable? Why are adolescents particularly vulnerable? They would often say because they're irresponsible or they don't take malaria seriously. When I talked to the adolescents, of course, they would say we take it very seriously, but we don't have the resources necessary. We don't have adolescent-friendly services to access it when we need it. To me, I think this gets to a crux of a lot of what adolescents face. I would love to hear your perspectives on that and what we need to change on the supply side as well as the demand side to improve adolescent access to health services.
Thank you for that question. We can quickly touch on it. There's a session coming on afterwards on behavioral interventions. And you know, this is something that really needs to be talked about. How can we bring the different perspectives together? Could we take 2 comments from there, the last one here, and then wrap up the panel?
Thank you. My name is Thiago Lucas. I work for Save the Children, also on the board of PMNCH. I had a question for the panel. I wanted to hear from you what you think about the need for creating a social movement. I agree with you that we need more resources, but also we need people and young people to get behind all these asks. So I wanted to hear from you on creating a social movement.
Thank you, sir.
Hi, my name is Lena Minjoo with the International Women's Health Coalition. First, I want to say thank you so much for bringing up intersectionality in all of your comments. IWHC worked very closely on the SDGs. Obviously, we all know about the SDGs, and Ms. Mohammed's comments, the SDGs came up a lot. But I wonder often how localized they are at this point. And if you have done any work to kind of localize them with youth, and if you have, how, and what messages have resonated. Thanks.
Thank you. Please.
Hi, everybody. To everyone in this room, which we keep talking about financing and investing in youth. My name is Jillian from the International Youth Alliance for Family Planning, and I'd love for the panel to actually share their experience in accessing funding. Because yes, we need to invest in youth, I wholeheartedly agree, but unfortunately, there's so many barriers to those investments. You need to have 3 years worth of financial statements. You need to be an established corporation. You need to have a board. You need to have, 3 years worth of annual reports. A lot of adolescents don't have that. So what are your suggestions to mitigate that, and how can young people actually access those funds? Thank you.
I'm thrilled with these questions because that's what this panel was meant to do, to get the juices flowing, to get our gears churning. And so what we have is very quick answers and then a nice strong cup of coffee. I think we have only 2 minutes left, so we won't have time for responses. These are discussions that will need to go into the panel. So Anthony, Gigi, Irem, Reina, you have a room full of people listening to you. When you walk away from this panel, what's the one message you want to leave them with? 1 word, 1 phrase.
Okay, this is a bit of a challenge, but also reflecting on the social movement question. I think all of us have been reading...
1 word, 1 phrase.
It would be a bit of a phrase, but I think this really deserves the attention. Basically, we read the news and we say, this doesn't make sense every day. And that's the key, I think. Things are not about the truth or the rational things. It's about passion, it's about identity, it's about values. So whether it's young people or anything else, we really should be talking about these, and we should be putting those at the center, not just the jargon and the technical.
So Irem, thank you for that answer. I'm going to come back to you for 1 word, 1 phrase last. Gigi, you're next.
Yes, I just wanted to say that for those who asked the question on how best to support young people's organizations that don't meet like due diligence requirements, and also on how the kind of protection we need for in-country, I'd be happy to discuss with them after this panel if they could just come to me. I'll find you, whichever way. But yes, I feel like I'd want to discuss that with you beyond this, since we don't have a chance yet.
Lena?
And to quote on Michael Carruth, who is a doctor / advocate for First Nations health, there's a quote here that says, the healthcare system on reserves is far more inferior to what other people get, period. And this has taken children's lives.
Thank you. Please.
I was thinking of a word and a quote, actually. My word would be power, all right, in two contexts. Power, that we have the strength. Adolescents have the strength and we are not powerless. The quote that I was thinking about was, if you always do what you always did, you will always get what you always got. So it's important that we innovate and ask young people what they think should be done right now.
Thank you. Do you have anything to say?
I think it's human rights and dignity. It's all about that.
Human rights and dignity. Can you join me in congratulating the panel for their great job?